chair of the Democratic Party of Bernalillo County, and so honored to serve you in that capacity. I am joined tonight by my vice chairs, Danny Leyva and Marisol Enriquez, as well as Secretary Jenny Lusk and our treasurer, Paul Tumping. Very, very fortunate to have such a strong and cooperative and awesome team. So we will be starting off tonight with Planned Parenthood with Kayla Herring, and hearing from Kayla about our current state in New Mexico regarding abortion and what we can do to participate in what needs to be done to strengthen New Mexico and to help others across the country, really. And then from there, we will go on to talk with Jessica Velasquez and Sean Ward. I saw Sean's name hop up and, oh, there he is, Sean. Oh, look at your beard there, Sean. My goodness. That very cool. And then we'll be talking about the coordinated campaign. We need to gear up for the general election. And so we're looking forward to talking with Jessica and Sean about that. So to start off with, some of you may or may not have seen the PBS Merits poll that had some data on Americans and abortion. And 66% of Americans say they have either had an abortion or know somebody who has had an abortion. And, out of those Americans, 55% of Americans support abortion rights, 84% of Democrats and 59% of independents support them. And when these people, this general poll is asked, how are you more likely to vote because of the Supreme Court decision that was just passed down? 78% of Democrats said, yes, I am more likely to vote. 54% of Republicans said they would be more likely to vote. And 53% of independents said that they would be more likely to vote. So we have work to do. And we are so glad that we're on the side that is working on behalf of reproductive health and rights. And so with that, I'd like to turn it over to Kayla Herring, and she'll introduce herself and tell us a little bit more about where we are here.
Hey, y'all. Thanks for having me tonight. I know it's been a heavy weekend and a heavy week, and I really hope that all of you have made some time for rest, for joy, for being in community, being in family. I know that seeing the Supreme Court overturn the right to an abortion is a very hard blow for a lot of us, even though we were expecting it. My name is Kayla Herring. I use she, her pronouns, and I'm the Director of Public Affairs for Planned Parenthood of the Rocky Mountains in New Mexico and Planned Parenthood Votes New Mexico, who engages in elections work to ensure that champions for abortion access get elected up and down the ballot in our state. I have been with Planned Parenthood for about 5 years. I began my work as a patient advocate and a volunteer. I then moved into our organizing team. I've spent the past 4 years as the manager of our organizing team. And in the last couple of months, I took on our director role. So I really have climbed up that ladder of engagement. And I'm just so appreciative of our team of organizers who are working on the ground to build community to ensure that abortion remains legal in New Mexico. I'm so proud that in New Mexico, we repealed our old abortion ban last year, so just in time. We repealed a ban from 1969 that would have forced a pregnant person to beg for an abortion in front of a panel of strangers on a hospital board. We know that other states around the country are not in this space of celebrating that they have safe and legal access to an abortion. And we can't take that for granted. We have a lot of work to do to keep that majority in our state house and to keep our governor. So, like I said, abortion is legal in New Mexico, and that We don't intend for that to change. In New Mexico, you can get an abortion through Planned Parenthood or through any of our other providers and our independent partners who are in Albuquerque, Santa Fe, and Las Cruces. We are engaging right now with our partners, specifically Strong Families, Bold Futures, Table Women United, the ACLU, and Progress Now New Mexico, in understanding what legislation looks like to beef up protections for abortion access. We're very proud that in New Mexico in the 90s, a very smart woman, many of you may know, Maureen Sanders, argued for abortion protections through our Equal Rights Amendment. So we have some really strong protections for abortion access in our state, and we're figuring out what's next and expanding access. Even under Roe v. Wade, many in our communities, specifically Black, Indigenous, people of color, queer and trans folks, low income and rural communities did not have real access, even with the right to a legal abortion. So that's what we're trying to figure out, is how we expand that access, not only for our communities at home, but our neighbors who will travel to us for safe care. That's a big undertaking, and we can't really do any of that if we don't have success at the ballot in November. So Planned Parenthood Votes New Mexico engages in candidate endorsements, highlighting champions who are with patients and their access to abortion care 100%. And we are working on making sure they get elected this November. So if you're interested in any of the work Planned Parenthood Votes New Mexico is doing, I know you all are very engaged. I heard Flora talking about your coordinated committee. Planned Parenthood Votes New Mexico has one as well. And we will be working on doors, on phones, and community, ensuring that champions for abortion access get elected up and down that ballot. Those are some of the things up next, but we are also working to ensure that patients and providers are safe providing and accessing care. So as Flora alluded to yesterday, our governor signed an executive order which states that patients will be safe coming to New Mexico to access an abortion, and that providers will be safe providing abortion care in New Mexico, not only to New Mexicans, but those who travel to us for care.
You are doing some good work, Kayla. Very sure. Yeah. So we know that I'm thrilled to hear you saying that you're going to be knocking doors and phone banking. And are these doors, these canvases and phone banks, going to be in specific House districts? Is that what you're looking at?
Yeah, so Planned Parenthood Votes New Mexico Coordinated Committee will be in the campaign space working directly with our Planned Parenthood Votes New Mexico endorsed candidates. We're currently in the process of going through some re-endorsements for different seats around the state. So in the next 2 weeks, we'll have our full list of general election endorsed champions.
Okay. And so one of the things that I always struggle with, and we'll talk about this a little bit more with Jessica and Sean as well with the DPNM staff, is that our canvassers, our volunteers end up getting pulled in a lot of different directions. Yeah. And it's so nice whenever we can have them, hit that same door instead of duplicating efforts. We're able to really take our resources and make the most of them. Is there any coordinating effort going on with the House Caucus or with the coordinated?
Yeah, so in Planned Parenthood Votes New Mexico Coordinated Committee, we're a really small team. And so we, this cycle, will not be hosting our own canvases. We will be joining up with candidates, deep work with their campaign managers, the candidates themselves, to send our volunteers directly to candidates, so that we are not trying to coordinate universes and duplicating work like you mentioned.
That's beautiful. That's beautiful. And the what should we watch for here in New Mexico? What are some of the things that we need to have our eye out for?
So I would say it's really important to keep an eye on what the governor's future executive orders may look like. She is committed to working in collaboration with our partners moving forward to ensure that we are able to address urgent needs as they come up. The scary and unprecedented space that we're in is that 26 states are likely to restrict or outright ban abortion, which means there are 26 state legislatures, 26 governors, 26 attorney generals who, for lack of a better word, can be really creative in the ways that they seek to eliminate abortion access. So we are going to do whatever we can to make sure that our patients are safe coming to New Mexico and our providers are safe in providing that care. And so as we hear from our providers and our patients and we see what's happening on the ground and in community, we will ensure that we're able to navigate those new circumstances. And then our partners are working through what it looks like at the legislature next year. So keep an eye out from Planned Parenthood, from Strong Families, from Bold Futures for very quickly coming together soon policy agenda that will address some of those urgent needs for our patients and our providers. And Planned Parenthood has an amazing team of organizers who are working on the ground. We know that New Mexicans across our state are really wanting to engage in the work for abortion access. And we have an amazing infrastructure of reproductive health rights and justice organizations who have been doing this work for a long time. So I can share after this a list of events and resources that folks can get engaged through. And when you're in conversation with folks, you can share those as well. So people can kind of funnel their channels and their energy into good spaces.
That sounds perfect, because I was contacted by someone this week, and I think she's on the call here, Cheryl Harris, that wanted to know, what's being done to help transport women that want to come and have a safe and legal abortion.
Yeah, so the Religious Coalition for Reproductive Choice is the organization that convenes and trains and coordinates supporters and volunteers who help with transportation. They help with housing if needed. They drive people to and from airports and appointments. So if you're interested in any kind of direct patient transportation or housing, the Religious Coalition for Reproductive Choice is your group.
Okay, that's good to know. And you talked about policy. So what I heard you say is that you're going to be looking at policy that offers protection for providers, and another group, was it people who transport and that kind of thing?
Yeah, so for providers and patients, generations and generations of work have been done in New Mexico to put us in a situation today where we are not living in an emergency for real restrictions to abortion access in our state, which is amazing. And we now have an opportunity to look at what are the most critical needs specifically for people of color and rural communities in New Mexico. So we're thinking from that lens, and then also from the new lens of patient and provider safety as other states look to restrict people's movement and ability to access care.
Oh, that's excellent. And I see that our wonderful state Democratic Party chair, Jessica Velasquez, has her hand up. Jessica?
I have a quick question and observation. Driving across the country because I booked my kids for summer camp, and we have driven through Texas, Oklahoma, Missouri, Kansas, Iowa, Wisconsin, Minnesota, which is still, they're going to be very much like we are, kind of an island of blue and of access in a sea of red and of restrictive environments. And there's been a lot of talk recently. I mean, we desperately need to keep our care providers safe, our patients safe. I want to throw this your way, Kayla, just to bring up, because it's been something that I've noticed driving through states that have anti-abortion billboards every 5 miles, that have churches. My friends, we are lucky to be in New Mexico. That came resoundingly true for me as I'm witnessing this across America right now. We've got churches that actively have these billboards and these posters endorsing candidates and endorsing propositions that these states already have kind of loaded up and ready to go for us. So my question here, Kayla, and I would love for this to go upriver to folks who are actually working on policy, in addition to providing safety physically, right? And freedom from repercussions if folks do cross state lines to seek abortion care. I am deeply concerned after seeing all the posters for pregnancy crisis centers and pregnancy support centers that we know are mining data and information, and they are not bound by HIPAA to keep any of that confidential. And when I kind of got curious about it, and just once I got to a gas station, had to do some Googling on my phone to find out how many millions of people across the country have inadvertently walked into these centers thinking they're going to get help. And in some cases, like Dallas is a great case in point, you Google abortion care or abortion providers, and they're stealthy. One of these centers comes up and it is backed by these coalitions nationally that are anti-choice and anti-woman. And it hit me like a ton of bricks while I was driving that anybody who has walked through their doors, and a lot of times they have strings attached, and many of them get state funding, right, to provide, pregnancy crisis care, up to and including, incentives, right, for women to come to these centers. So I really want to just put it out there toward Planned Parenthood and all of our allies, in addition to providing safety for our patients directly in terms of their physical safety and access. I really hope there are conversations happening around people's private information, especially, I would love to see the New Mexico legislature, much like Pennsylvania, take this one on, that these centers are, excuse my language, but are absolute bullshit, and are certainly taking advantage of women, especially in minority communities, people of color, who do not have additional resources to go further outside of their communities. They very intentionally put these centers right in the heart of communities of color. So I hadn't really thought very deeply about this until I was driving across these red states, Kayla. So thank you for giving me 30 seconds to vent, because I'm horrified, my friends. I couldn't believe what I was seeing as I'm driving across these states. So wanted to bounce that ball over to your court about legislative initiatives, and just to hear if anyone's talking about that in our state as well, because we have there's one of those centers right next to the Planned Parenthood facility on San Mateo in Albuquerque. It's horrible. Okay, I'm done. Thank you so much. As all of us, we're very emotional this week. So thank you for hearing me out.
And I'm gonna kick it over to Kayla answer, but I want to say there's no need to apologize for language, Jessica. I think the majority of us have cussed more in the last few days than we have in recent years. So it's understandable, and we just never thought we would be at this place that is just so blatantly misogynistic, and we're horrified. So thank you for voicing it too. Yeah. Kayla, would you like to address what?
Yeah, so Jessica, I want to thank you for bringing up the crisis of crisis pregnancy centers. So for those who don't know, crisis pregnancy centers are state and federally funded organizations. They don't provide abortion care, clearly, so they are not bound by the Hyde Amendment like many abortion providers are. What they do is they take in vulnerable women, they tell them that they're going to offer them comprehensive reproductive health care, and they lie to them. They tell them that if they get an abortion, they may get breast cancer, they'll become infertile, and other really strong lies that really terrify people away from making a decision that they might have chosen for themselves. In New Mexico, we have a task force working on addressing crisis pregnancy centers. And I can share that we heard word from many women and people accessing abortion care in New Mexico that they drove to New Mexico, they took the time off that they had from work, they accessed the childcare, the very limited childcare they could. They spent their hard-earned savings accounts coming to New Mexico for an abortion, and they found themselves at the doors of crisis pregnancy centers. meaning that they were unable to access an abortion because their resources were completely depleted from the bogus trip, basically. So we have a coalition of organizations who are working on addressing crisis pregnancy centers. One of them that Jessica alluded to is the fact that they are not a medical provider, and so they are not bound by HIPAA. Folks don't realize that, and so they give out their complete medical history, their sexual health, their sexual activity. And we have even seen instances where crisis pregnancy centers will share that information with someone's faith leader who is anti-abortion. So when that person goes to church the next weekend, their faith leader who's anti-abortion knows they were trying to get an abortion, which is devastating for folks who believe that they can carry their faith and their support for abortion hand in hand together. We have an event around crisis pregnancy centers on July 18th. So I can share information about that with you, Flora, after this event, so you can share it out with folks. We're not 100% set on what policy looks like for this. We are really trying to figure out policy that will actually fix the problem, but we're working on that. And then we're also working on understanding where their funding streams are, because we know they receive state funding. And so figuring out what and where, which department and who and how much, and meeting with those folks to educate them, because oftentimes they don't know either. And so making sure people have the information about what the state is funding. So thank you, Jessica, for bringing that up.
So is there the possibility of having some kind of legislation that would change, one, their funding, and two, their ability to share out information?
Yeah, that's what that task force is for. And so right now they're in some fact-finding phases. They're in some community conversations about what the impact is. The other real thing that we have to address is that crisis pregnancy centers do provide material support to pregnant people. It comes with strings tied. It comes with guilt and shame. And if you go to a crisis pregnancy center and you need a crib and you need clothing and you need diapers, they often can get them to you. So we also understand that there is a real gap that sometimes they are filling. And so thinking about how we, in a comprehensive reproductive health rights and justice space, can fill that gap as well.
That's beautiful. So I see that Cheryl Harris is in the stack. She has a question. Cheryl, what would you like to ask or share?
Not so much a question, but if I could have 2 minutes. Yesterday, Dorothy Wilkinson, a ward chair, and myself met with Carl Boaz, who's a retired Methodist minister. He started work in helping women 50 years ago in New York as part of the clergy consultation service. The RCRC is active here. I put their phone number and their project director in the chat. Carl is still active here. And when he moved from Dallas to Albuquerque, Dr. Boyd, who does late-term abortions, he has a clinic here. We have our wonderful Planned Parenthood. And then I believe, if I'm not incorrect, ma'am, UNM is the other abortion clinic here in the Albuquerque area. But he has been helping bring women here, and the RCRC has for over 20 years. During the pandemic, they were flying groups of 20 women from Dallas here on weekends via a special rate they got with SkyWest, and putting them up in hotels and everything. So what we have today is, I think, a big project where we have to coordinate the activities and funding of our providers like Planned Parenthood and this support network like the RCRC does here, or the CRCR, sorry. And they are looking for volunteers in that group. Carl walked me through the process of picking people up at the airport, taking them somewhere to a home or a hotel. It's tricky, and it's sort of under the radar. We have to keep the schedule private and everything, but people who want to help in any way and donate money to Planned Parenthood or RCRC, it's very active here, and we're going to need it more than ever. I also talked to Pam Herndon on our state one of our state officers with Jessica, and she said they expected the abortion rate of out-of-state women coming here to more than double probably in this next year. So
Yeah.
we need to all be in it together and do something.
Yeah, I agree. Thank you for that update, Cheryl. And for those of you who aren't aware, RCRC, she's referring to the Religious Coalition for Reproductive Choice. It's a phenomenal organization that has been active in New Mexico for a very long time, and they do a lot of valuable work here. So thank you for that, Cheryl. And getting it back to Kayla, I'm curious just on this is kind of changing topics a little bit, but just statistically, a lot of people where they end up having a hard time with abortion is late-term abortions. And, we hear that over and over again. What are the statistics when it comes to late-term abortions?
Sorry, my dog has learned to open the door here, so I have to run and shut it. Otherwise, you all hear my dryer. I really appreciate you plugging abortion later in pregnancy as something to talk about in this group. What we know is that when a person has to make a decision to have an abortion later in pregnancy, it's often after they have picked a name. It's often after they have created a nursery, shared with family, posted pictures. We know that abortion later in pregnancy is a decision that people are not always prepared to make and have to in circumstances that they aren't expecting. For anyone who has ever been pregnant, who has known someone who's pregnant, every pregnancy is unique, and every pregnancy changes entirely from the course of beginning to end of that pregnancy. What we know is when a person needs to make a decision about abortion care later in their pregnancy, they deserve to make that decision with compassion, with their family, with their faith, with their medical provider, and not face criminal punishment or the law or any kinds of restrictions. So few. It's like less than 1% of folks of abortion access happens that late in pregnancy. And it's really horrible to me that people see banning abortion later in pregnancy as some kind of I heard Mark Ronchetti say it was a moderate compromise. That is not true. Banning abortion later in pregnancy is callous and cruel and puts restrictions and timelines on people when they are extremely vulnerable in their lives. What we know is that when people have to make that decision, it's extremely complicated. And we need to be there for those people who need to access abortion later in their pregnancy. And I am so proud of New Mexico and of Southwest Women's Options for providing abortion throughout pregnancy. They are the most compassionate, wonderful abortion providers that I have ever met. And they take their job so seriously in ensuring that folks who need to make that decision later in their pregnancies are able to do so. So if you hear anyone talking about abortion later in pregnancy and talking about, well, if we ban abortion at this time, it will be fine, I would love for you to think about people who lose their pregnancies, whether it's an abortion or any other reason later in their pregnancies, and what that feels like and what they need when they're in that place. And what I think they need is compassion, love, and healthcare. Not bans, not restrictions, not criminalization, and not the government telling them what they can and can't do.
I agree. And not judgment. I wish it would be anti-judgment. That would be just so nice.
Yeah.
And, I know that Planned Parenthood puts a lot of work into understanding what is the right way to frame messages. And most of us are, we just come out, well, I don't like it and it's not right. And so can you help us with some, what are some conversations as we're around family now for the holiday weekend, what are some ways that we can talk to people who may not be on board with a woman's choice?
I love this question. And we've done a lot of work in New Mexico in understanding how to connect with people who may not see themselves as pro-choice. You'll notice that I have not said pro-choice, pro-life today because it doesn't connect with people. People don't like labeling themselves. They don't like putting themselves in boxes. And so many people who would support their nieces, their cousins in getting an abortion would probably never identify themselves as pro-choice. So Planned Parenthood's amazing partners, Strong Families and Bold Futures, did a survey of rural New Mexico in 2019. And what we found was across all backgrounds, including religion, 79% of rural New Mexicans agreed with the statement that I can hold my own moral views on abortion and still trust an individual to make their own reproductive healthcare decisions without government interference. So what we're acknowledging in that statement is that someone personally could never choose abortion for themselves. They can understand and know that that is not a decision that they would make and still trust their neighbor, their friends, and their family to make those personal decisions for themselves. So as you are having conversations with your family, I know I am, I'm sure you all have had conversations too. I want us to think about abortion care in singular instances, not in statistics, not in numbers, not in this overarching big picture idea, but in the individual decisions that people make in consultations with their family, their friends, their medical providers, whoever it is that's important to them, and that the government doesn't need to have a say in those individual medical decisions. We talk about abortion care as being compassionate, as being comprehensive. And Dr. Carroll, a New Mexico abortion provider this weekend, said that abortion is love, abortion is freedom, and abortion is justice, which I think is so true. The ability to make our own medical decisions is core to our ability to be whole in ourselves and live happy and healthy lives. So I would love to invite you all. I know it's different, it's strange. You also hear us talking about women and people and patients and queer and trans folks accessing care because we want to be as expansive as we can in talking about abortion decisions. We also don't necessarily use the word choice anymore because we understand that there is a weight behind the decision to have an abortion. Choice is a little more casual, but the decision to have an abortion really is a sticking point with community. So top lines, we don't say pro-life, pro-choice. Fun fact, that dichotomy was actually created by anti-abortion advocates. So when we talk about it, we're actually using anti-abortion messaging. So if we stick with personal medical decisions, if we stick with that we trust people to make their own decisions and we don't want government interference. And that was true across all religious backgrounds in rural New Mexico, including 53% of evangelical Christians, which is a group that we don't actually ever expect to support abortion. And they do when they can also acknowledge that it's not a choice they would make for themselves. And I can share that one pager with you as well. Flora asked some really good points in there. So people can read through it, stick it on your fridge. I don't know, I pass it out sometimes to people. But it's a really great resource for actually having deep connecting conversations with folks rather than saying I'm pro-choice and someone else saying, well, I'm pro-life. And that kind of ends that conversation there.
Mm-hmm. Yeah. And being able to give words to the ideas that where we can actually hear one another and get past the barriers that are separating us. It's so important. So yes, I would love to have that and share amongst our volunteers. And I am. I heard what Cheryl said as far as what the increase that Pam was talking about, and I recently heard on a radio the Pink House, I believe it was from Mississippi, is opening a Pink House here in New Mexico, And how many of those are we expecting to happen now?
So New Mexico is one of 6 states that is projected to see the highest increase of patients seeking abortion care. That is for our geographic location. That is for the affordability of the general affordability of coming to New Mexico, as opposed to like flying to Hawaii for an abortion. So we are also seeing an uptick in providers interested in coming to New Mexico. The pink house is Jackson Women's Health, which was the provider involved in the Supreme Court case. So the full Supreme Court case was Dobbs versus Jackson Women's Health. So they have purchased a building in Las Cruces and are working on opening. I don't know, I'm not sure what their timeline looks like. I heard July, but I know getting a medical license in New Mexico takes a bit longer than that. So we'll see. We have had conversations with multiple organizations who are looking to come to New Mexico for care. A lot of folks want to open up in Las Cruces, and we are asking that they partner with Strong Families and Bold Futures to ensure that as they come to New Mexico, they are also coming with the values of compassion and care and community centeredness, so that it doesn't feel extractive. People coming into New Mexico, setting up shop, things like that. And so we're working really closely in lockstep with all of the partners who are coming. I can't give you a number, but I know that we've had like 6 or 7 conversations so far, not confirmed, but people kind of scoping out whether they're interested or not.
Well, I'm so glad that we are a haven for women and for healthcare. And so thank you for that update. Laura, do you still have a question?
I do. Thank you, Kayla, for your presentation. So when you're talking about messaging, one thing that I haven't heard a lot about that I feel very compelled as a woman is equality. And that choice is a decision for me to make. And I think a lot of times I've been having these conversations, everybody's thinking pro-choice and pro-life are the same thing, when pro-choice is up here, and what you decide with that choice is either direction for whatever your circumstances are. So is there a way that we could message that part of it? Because the idea that, and I've told a lot of people this, is you think you have more rights than I do. You think you're above me. This is to some of the men that I've had a conversation with. So you think what you know is better than what I know for my own self. Is that resonating with people? I mean, I've seen that it's starting to resonate for me in conversations in rural New Mexico, but is that something you guys are thinking about as far as equality and fairness? Like, that's what we went back 50 years.
Yeah, so some of the messages that we've seen that are really resonating in New Mexico are along the lines of equality, and the words that we're using are dignity and respect. Those seem to be really sitting well with people. If you are having conversations about equality and that is working for the folks you're talking to, I encourage you to continue using it. I don't think we've done specific studies on the word equality, but what we talk about are New Mexico values, generations of care, trust, and respect. And so I think equality kind of fits in with those messages. So yeah, that I think is pretty in lockstep with the way that we're talking about abortion.
Yeah, thank you for that. And it's when we look at the statistics that I opened up with, that 66% of us know, and that's actually what is known, and that there are so many women that we don't know have had abortions, and nor is it our business to know them, right? Know that about them. It's their own private decision, and so but so many people don't realize that. And as I had written a few months ago in a piece, that when those people who are sitting in these pews, they can look to the right, to the left, in front, and then back, and which one of those women, 1 in every 4, would they choose not to be there because they did not have access to a safe medical procedure? And so, to help people understand that this is about keeping our loved ones with us and to be loved and to be loved by them. So with that, I'd love for you to give us any closing remarks that you have, Kayla, and let us know what we can do to support this effort.
Thank you, Flora. So I think it's so important to underscore in every conversation you have that abortion is legal in New Mexico. Every time we see an abortion ban in a neighboring state or with the Supreme Court decision, we see patients in New Mexico canceling their appointments. Laws and Supreme Court decisions are written in really complicated legal jargon that people don't often understand, right? I didn't read the Supreme Court decision. I'm not a lawyer. I read the first page. And so it's so critical that we ensure that people know abortion is safe and legal in New Mexico. I also will add that as 26 states seek to ban abortion care, we need so much support in the material access of abortion. So we've talked about the Religious Coalition for Reproductive Choice. We also have Indigenous Women Rising and the Mariposa Fund in New Mexico and the Planned Parenthood Patient Assistance Fund, who has provided more resources to patients than I think we ever thought possible. We're working through pulling the dollar amount and the number of patients we've supported since Senate Bill 8 in Texas. And I can't specifically share that number yet, but in the last 6 months, I believe we're almost at $1 million. So that is a huge load and a huge lift that we're doing to ensure that patients can access care. So if you have funds, being able to donate them is a wonderful thing. If you don't have funds and you have time, volunteering with those organizations and with Planned Parenthood is a wonderful thing you can do as well. And the easiest thing is to have conversations around abortion with your loved ones, with your friends, with your family. When we're silent on abortion, we stigmatize abortion. So the more that we can bring abortion access into conversations, the better New Mexicans will be in understanding that they're personal medical decisions and that there's no reason to feel shame or stigma around accessing critical health care.
Thank you so much. Thank you for the work you do, Kayla, and thank you for being with us tonight. Appreciate you. If you would please drop the website or any information in the chat so we can make sure that we get people together with the work that needs to be done here. Thank you.
Will do. Thank you. And I'll send you those resources to share out.
Beautiful.
Okay. Thanks, everyone.
And now it is time for our second half of this program. And we are so honored and happy to have with us tonight the Democratic Party of New Mexico chair, our wonderful Jessica Velasquez, and our executive director, Sean Ward. And both of them are doing a phenomenal job. And they've really brought the party along so far, and we have lots to come to see what they're going to be doing in the general election. So I've asked them to come and share with us about the coordinated campaign and what we're going to do now that we have the primary behind us. Ms. Velasquez and Mr. Ward.
Well, Flora, thank you so much. I'm going to jump in first so that we can talk in broader terms. And then, as in many things, I leave it to my executive director to deal with all the nuts and bolts, right? So, my friends, this has been a heavy week, a heavy few days. It hasn't even been a week. So before we even talk about elections and party operations, I want to share with you my heartfelt thanks and gratitude to be standing shoulder to shoulder with Democrats like you across this state. My little girl is 13 years old and took them all to summer camp this week. And we're driving across red states. And those of you who were on early kind of heard about this. I have never been prouder to be a New Mexican. I have never been more clear on how important our state is at this critical time than when I have now in the past, 2 days, 24 hours, I don't know. I've been on the road, driven across Oklahoma, Texas, Missouri, Iowa, Kansas, and to see the absolute war on women in this country. I realized how lucky we are to live in our blue bubble of New Mexico, which is not as safe as many people would like to think, which is what we're going to talk about tonight, and how we maintain our autonomy and our freedoms here in New Mexico. Because I can tell you, my friends, after this experience of driving to go see friends across the state and to go do language immersion summer camps with my children, which, you know, when we planned this a year ago, seemed like it was going to be a fantastic, you know, little sliver of time that we get to take a break and I can spend some time with my kids. Well, that is not what happened, because my daughter, who's 13 and very aware of all of this, we drove past billboard after billboard after billboard that were absolutely anti-abortion and anti-woman at their heart, that women are meant to be punished, right, in this scenario here. And my 13-year-old daughter looked up at me, and we're lucky enough to have my mother still with us, and she lives with us. And she's of that era that they had to fight real hard to secure the freedoms that my generation enjoyed. Enjoyed isn't even the right word, but that benefited from, right? And my daughter turned to me while we were driving across Iowa, and we saw yet another one of these billboards. They're every 10 miles, my friends. And she said to me, she said, "Mom, it's going to be me and you because grandma's getting old." And that hits hard. And I share that story with you because I know so many of you have been in the trenches for so long. Some of you are newer to it, and we're so glad for the help. The election this year could not be more urgent. And the role the parties play, whether at the state or the county level, could not be more critical. We cannot afford GOP leadership at any level in any office across the state. That became abundantly clear to me in these conversations with my daughter right now, and as we're driving across this country of ours. So I know it has been emotional and heavy for so many of us. We are here together, and we are here to make sure that New Mexico stays strong, that New Mexico maintains our autonomy and maintains our reproductive freedoms for all people, right? Because you're less than human if you can't at least control your physical body. We will not stand for that in New Mexico, not in our backyard. And so that's where elections come in, right? We have to win elections to make sure that we are protecting people's basic human rights. So here's what that's going to look like from the party end. First and foremost, and forgive me, Governor Michelle Lujan Grisham, you're fantastic, but I want to start about the state legislature. Okay, and we know that the governor's at the top of the ballot. She's been a huge champion for all of us, but I really want to focus in on the state legislature, because if we lose the state house right now at this critical period in time, no matter how incredible our governor is, and don't get me wrong, she is incredible, she will be hamstrung in keeping the rest of us safe. So I'm starting this evening very intentionally with a conversation about what we need to do to maintain our leadership in the state house. So if our state legislature goes red, right, we lose our chance to demonstrate to New Mexico and the nation what a government that focuses on safe, healthy, working families looks like, right? We're already paving the way to free college. We are tackling climate change at the state level. We are building an economy that works for everybody, and we are safeguarding reproductive freedoms and autonomy. We can't do that without a strong Democratic state legislature. If you want to see what happens when even one chamber is lost, you need look no further than the gridlock that we see on the national level in the US Congress. So state legislature will be key. And I'll let Sean fill in kind of the details of how all of us can roll up our sleeves and get to work in the state legislature. Now, having said that, here's the neat transition over to Congress, right? We have to do our part to keep Congress in Democratic hands, right? We cannot afford to lose races at any level, and this is true across the nation. Democrats typically perform poorly in midterm elections. Couple that with the fact that the party also holds the presidency. And now we see really piss poor performance in the midterms. We have the top targeted congressional seat in the country in CD2. Now we have our candidate, that would be Gabe Vasquez, right? This is the top race in the nation, my friends, because this is an opportunity to pick up an additional seat that may not happen nationally. Okay, so that's why we're going to get a lot of national attention around the CD2 race, because at this point, strategically from a national level, we want to make sure that we are picking up every seat we possibly can and leaving nothing to chance on that front. So Gabe Vasquez will be getting a lot of national attention. And I hope, frankly, I'll say this publicly, a lot of national money, because until we have meaningful election reform, we do not win races without money. So CD2 is going to be extremely important. Now, we have to keep our eyes, we cannot take our eyes off the ball in CD3 or CD1, because this is the first election cycle after redistricting. Okay, so we have a lot of attention in New Mexico, even though we only have 3 congressional seats. Folks are paying attention nationally. We want to make sure that we reelect Teresa Leger Fernandez and Melanie Stansberry. And now we're going to go for the trifecta on that level by adding Gabe Vasquez. So do what you can to help those races, whether that's volunteering, whether that's giving money, whether that is writing letters. You know, there's so much to do. Now, we're building up, right? Now we're going to talk about the big race, the gubernatorial. We have one of the top targeted gubernatorial races in the country, and we will be taking absolutely nothing for granted. Okay. If we fail to re-elect Governor Michelle Lujan Grisham, we're going to see everything kind of come to a screeching halt, my friends, right? Governor Lujan Grisham has created tens of thousands of jobs. She has invested over $1 billion into our education system, legalized cannabis, repealed that abortion statute, right? Which is I mean, we cannot take our eyes off of this right now. This is going to be the fight of our lifetimes, my friends, and we've got an incredible warrior and champion in our governor, right? We have one of the best governors in the country, and the GOP knows that. The Republicans know it. We're bracing up already for a really heavy investment from the national, Republican organization, because they're going to try to take the governorship from New Mexico. We looked at data from the previous recent election cycles, and here's what we know. Because turnout in midterms is low, okay, turnout drops by an average of 15.7% thereabouts. Democrats suffer because Democrats don't go to the polls. We have lower turnout. So what happens usually on average is we shed just under 95,000 votes during the midterms. If that trend continues here in New Mexico, we have a 22,000 vote gap that we will need to compensate for, we'll need to make up for. Okay. And so I know that now more than ever, I'm ready to roll up my sleeves and get to work and march into battle to make sure that we win these critical races. Not to mention our statewide offices. We have incredible candidates. I have never been so excited to help work for statewide candidates than this election cycle, because we can see already that everything from the treasurer's race, from the auditor's race, the AG's race, we've got an incredible Secretary of State, y'all. Right, Maggie Toulouse-Oliver has to win her re-election. We've got an incredible state land office and Stephanie Garcia-Richard, right? We have such opportunity in our state offices that we cannot afford to drop the ball on any single one of these races, okay? And I am absolutely honored and thrilled to do whatever we can at the state level. And boy, we wouldn't be able to do that work without our counties. So before I pass the ball over to Sean to talk nuts and bolts, I gave you the big picture landscape view here. Y'all, please put your hands together for our Bernalillo County Chairwoman Flora Lucero, please, because if we lose Bernalillo, I can't even finish that sentence, right? We will not lose Bernalillo. We will absolutely do the work led by our incomparable chair, Lucero, to get the job done in Bernalillo, because by demographics and by population, we have to win Bernalillo County. So my friends, I'm going to pass the torch right over to my, I'm still absolutely speechless with how efficient, effective, and professional our executive director, Sean Ward, is in this role. Native New Mexican from freaking Cedar Crest, right? No idea. He's an East Mountain boy, born and raised. I'm happy to have in the role of executive director a real native New Mexicans to help me fill in the blanks here and to talk about all the details and the nuts and bolts of this work. So my friends, I give you my executive director, Sean Ward, to bring it on home and to talk details, especially about how all of you can get involved, because now more than ever, we need each and every one of you. We cannot leave anything to chance. We will go shoulder to shoulder into this fray because we know how urgent this is. This is the moment of our lifetimes, and we have a plan. We have a plan for that. So Sean, bring it on home, my friend. I yield the floor.
Awesome. Well, thank you so much, Chair. And thank you so much, friends, for having me on. So as Jessica said, if our trends continue, we know that we have about a 22,000 vote gap that we have to make up. And we also know that the GOP is going to dump millions of dollars here. And I wish that I could say that we could go dollar for dollar with the GOP, but I think we all know that we are not the party of the wealthy elite. We are the people power campaign. We are the people power party. So what we need to do is make sure that we are using all of those resources of our people power to turn out as many voters as possible to make up that vote gap and make our midterm cycle look more like a presidential cycle in terms of turnout. So the first thing that I want to talk to you about is we're running a coordinated campaign. What does that mean? Essentially, all of the campaigns will still run their campaign, but we are running a big field operation to make sure that we are turning out as many voters as possible. So like as Flora, Madam Chair said, we aren't all fighting over pools of volunteers. We're able to work together to talk to as many voters as possible, rather than doubling up efforts and asking the same pool of volunteers for, to come out for X campaign this weekend and X campaign next weekend. So even with us coming together, though, that pool of volunteers, the amount of time that we have to reach voters is really limited. So what we need to do is we need to make sure that with that limited time, we are focusing on the things that really turn out voters. And what we have found time and time again, what research has found is that voters, they don't want to be communicated at, they want to be communicated with, right? The issues, if I were to ask every single one of you on this call, 56 participants, what your biggest issue is and why that's a big issue for you, that's a deeply personalized thing. I would get 56 different answers, right? And 56 different approaches as to why that issue matters. So we need to focus on things that we're communicating with voters and able to relate their issues with the campaigns that we're talking about. And so what are we talking about there? We're talking about primarily canvassing and phone banking, those types of conversational approaches. In addition to that, we're going to be supplementing our program with texting to make sure that we're turning out our voter groups. We'll have a mail program that will focus on our statewide candidates. And we will focus also on relational, which is kind of the new tool where instead of just saying, hey, can you go out and talk to these 10 people that you don't know, look through your phone contacts and match it with our voter contact lists, and it will tell you which people you need to talk to that you're already friends with. So we're using the best tools that we possibly can to make sure that we're using our limited resources very intelligently. So, some of the things that we are going to do that we aren't going to focus too much attention on is the things where it's just kind of a blanket message to everyone. So think, postcards, billboards, yard signs. I'm not saying that those are not important. I'm just saying with our limited time, they aren't going to be the big thing that we focus on. So then the last thing that I really want to talk about is who are we talking to? So we'll be talking to primarily a persuasion universe during the summer, and we'll be focusing on people who, so persuasion, that's people who vote in almost every election, who sometimes switch which campaign they're going to support, which party they support. So we want to make sure that we're having a conversation with those people so that they vote for our candidates. And the second group of people that we're going to be talking to are those turnout people. New Mexico would go blue every single cycle if everyone turned out to vote. We all know that, right? So we want to focus a lot of our attention on turning out those people who support us but miss election cycles. We can't let this look like 2014. We need it to look like 2018. And the way we will do that is by turning out voters. So, and also I want to say with that bucket that I got asked a really good question down in Doña Ana. They asked, well, what does a coordinated mean? Are you talking about, the state house? Are you talking about every single race with a voter when you're at their door? The information tells us that really, you can only talk to them about 2 candidates. Anything past them, they just stop paying attention and kind of zone out and just like, oh yeah, I'm going to support that person, So it's more about who we are talking to. These are the people that we know that if we turn them out, they're going to support our Democratic slate of candidates, if that makes sense. So how can you help? Well, the biggest thing is making sure that you're helping us with canvases, phone banks, helping us recruit volunteers in your networks. I know a lot of you are going out in your precincts, your wards, you're focused on your local level, turning out those supporters. We have matched everything up with our field operation to focus down on the ward and precinct level. I will be, we're staffing up right now. We currently have 9 organizers in the state, 4 RFDs. We will get to a total of 26 organizers, as well as we will have constituency outreach specific organizers as well. So the big thing, we're getting some of the tools still set up, but I will make sure that Flora has all the information on how to connect with folks here. The RFD for Bernalillo County is Markella Clinton, and I'll make sure to connect Flora with her so that she can pass along her information. We need the boots on the ground and we need them going right now. So that's the big picture, quick overview of our coordinated program this year. Anyone have any questions, or Madam Chair, I'll turn it over to you, Flora.
Well, thank you so much, Sean. And we do have Barbara is in the queue to ask a question, but I just want to give a big shout out to our leadership, to you and Jessica. As I said, you guys are doing a phenomenal job, but one of the things that I am extremely happy about is that you are hiring local. And I am so thrilled when I look at the people that you are bringing on board, that you have brought on board, that they are actually New Mexicans. We are living the democratic values that we say we have. So thank you for that. I really appreciate it. And I think we're going to see a big difference where we're going to see field organizers and directors that understand our community, that understand our state, our people, and we're not going to have to help them to go through that learning curve of, well, no, okay, yes, this is, and explain to them the culture here. So thank you for that. It makes our boots on the ground job so much easier when we don't have to go through that learning curve with them. So really appreciate that. Jessica, you have something to add to that?
I have to just add to that, Flora. Thank you so much for recognizing that. It has been a core value for us from day one that we will, and y'all know me for a while now. I've stayed committed to hiring locally whenever, and it all, like whatever it takes to hire local and to make sure that our New Mexicans are doing this work. So I just wanted to give a shout out to all of our interns at the party, and then I will yield the floor. So in addition to hiring local talent and cultivating local New Mexican talent, we have also been able to get the intern program rolling. We started it in January. We have college interns for the moment. I would love to extend this to high school interns. We have some incredibly talented young people working full for credit and also this semester for pay. because
Yeah.
my friend, we're Democrats and we live our values. So if you have any young people in your university, I don't care which university they're at, we were able to get this rolling with UNM, and they were willing to grant credit to these students through UNM. But if you've got connections, my friends, if you've got folks at Western, if you've got folks at State, if you've got folks, you know, anywhere at any university, you know, at the community colleges, Sarah Adelson, I'm looking at you. No, just kidding. Please do let me know, because we're able to, you know, thanks to the commitment and generosity of donors, right? I'm able to actually offer paid internships, because we ought to be living our values. So the interns hopefully will be the next generation of Native New Mexicans that we can hire for all of this work. Gosh, our interns have put on this incredible event on Thursday. So I hope all of you have seen, you know, our last day of Pride event on Thursday. This was an intern event that they planned and executed with our support, but we are going to be roller skating with drag performers and candidates from the LGBTQ community on the last day of Pride. So come on out. It is a low-dollar event just so that we can cover the cost of the entire facility rental for security purposes. So we're at Roller King Skatorama. I think tickets are like $10 for students, $25 if you're not a student, but that's a sliding scale. So please share that. It's all over Facebook and social media. And I know it's been in the Blue Review. Thank you very much, Chair Lucero. So this is a way to uplift and celebrate our interns too. They will be the next generation of New Mexicans that we can hire to do this political work. So thank you for letting me talk about that. I'm really thrilled about it.
Thank you for that. And they have graciously extended that student rate to ward chairs and precinct chairs, because they appreciate the volunteers on the ground, the leadership that we all provide. So thank you for doing that. It seems like such a fun event. And also Beck Tuchin put in the chat that Gabe's campaign, CD2, is also hiring. So if you know somebody who is looking for a job with the Gabe Vasquez campaign, that would be another wonderful place to have people go. So thank you for that. So Barbara Warren, what do you have for us? What do you have, a question, comment?
I'm muted. Sorry. Question. If I get, I'm a precinct chair of 499. I used to be a ward chair, but that was more work than, so I turned it over to somebody who I thought would work hard and they disappeared. Anyway, I am very interested in whether, if I get a list from the coordinated campaign or my state rep or whatever, if I fill out the stuff in the VIN and put it in, is it going to be available to the other candidates? And that's very important, because I have a lot of personal contacts with the people in my area, and I don't want strangers to show up without not knowing that I've already contacted these people. They do swear on whatever, their firstborn or whatever, that they will vote and that they'll vote Democratic, etc. I want to put that into the notes, and I want the other candidates to be able to know that. Not necessarily the non-Democrat, you know, move on, will do their own thing, etc. But the other Democratic campaigns that are connected, I assume, through the coordinated campaign. And that was my question.
Yeah, and that's a very valid question, and I'm glad you asked it, Barbara, because and Sean can probably speak to this more, but I did talk with Corina Feldman, who is the director of the coordinated campaign this time, and exactly what you said is what they're going to be doing early on, and that's identifying straight ticket Democrats. And when we do that, that information will be shared with the House campaign so that they know what votes they can count on. So it will be shared across the different networks. Sean, do you have anything to add to that?
That's very well said. The only thing that I'll add to that is even those groups like Move On and some of the independent expenditures, if they work with this group, you know, not to bore you with details, there's a group out there called the Democratic Data Exchange. and they're actually able to get information on people that we've talked to also. They can't know what we were talking about or, you know, who we are as an entity when they see that data, but even they'll be able to see some of those support IDs, which is great.
How about the things that I did already walk for my state rep before the primary, because she had a whole bunch of people who didn't know who she was and they wouldn't know her. And I thought, you know, they might wonder what happened to their old state rep, etc. And so we were walking ahead. If I got a list from her and put that into the VIN, is that going to be spread out, or do I need to put that in again once we have the coordinated campaign going?
I would say it's always helpful to do it from the coordinated because it's a slightly different message. But one of the things that I will tell you is we have years and years of data, I think going back to 2007, and all of that data helps to refine our targets when we're talking about which voters we should talk to. So even if it doesn't directly translate into a support ID for us, that information is very valuable.
It's good to know, Sean. And when you talked about the relational organizing that'll be done, is that through that, what is the name of that app?
So there's a couple of different apps. We're trying to settle on which one we're going with because they're all very expensive. So we are trying to figure out which expensive thing we should do. It will either be an app called PDI or it will be an app called Impactive. One of those, they basically do the same things. It's just a question of which one's better at this point.
Would that be something that Barbara could use with her, she says she has the relationships with the people in her precinct. She'd be able to use that to put the data in.
Absolutely.
So I would be getting the list from that central location, not from any particular candidate.
Well, so we're still going to be using Vote Builder for our Canvas and phone bank stuff. So Van will primarily be the tool that we use for voter contact. But if you have relationships with people, then that's where that relational tool will be helpful.
Yeah, and yeah, thank you for that, Sean. So this year, 2 years ago, we were, of course, right in the height of the pandemic. We weren't doing canvassing. We were doing a lot of phone banking, a lot of texting. This year, I'm imagining that there is going to be, and you're probably already working on the canvases. Am I correct?
Yep, that's correct. I am a Canvas believer. As Sarah Adelson knows, I've knocked many doors throughout this state. So we will have a heavy focus on making those relationships and contacts at the door.
Yeah, and it's an important way, and especially if we could get some of that messaging that we were talking with Kayla about. I think there's going to be some of those conversations to be had now as well. And so you said the persuasion is going to be happening now in the summer. And then so maybe August or so we'll be transitioning into a different message. Can you tell us a little bit about that?
It's not so much, the real message won't change that much until we're getting into the early vote phase. What we'll do at there, it's kind of a very large universe for a majority of the campaign. And then when you get into early vote, it really shrinks down to people that we've identified through previous months as being supporters. That's when we just make sure that we're turning them all out and they're very quick conversations. These conversations should also be relatively quick conversations, but they should be meaningful. So that's more of a balancing act, whereas towards the end, you're just like trying to get as many people to go out as possible, if that makes sense.
Right. And September is voter registration month, right? I mean, it's not that we just do it in September, but I think like in years past, we do a big push for September to do voter registration, right?
That makes sense. Yeah. And I will say one of the apps that we're looking at for the relational can actually look through your phone book and tell you which of your friends in your phone book who live in New Mexico are not registered to vote. So really hoping to get that tool because that will help us with, actually having targeted voter registration conversations.
Nice.
If we don't get it, everyone on this call is going to be disappointed now, but I'll be disappointed.
Yes, yeah, I think all of us, our minds are already starting to go, well, wow, yeah, we could send them a QR code and just take it right up. Well, that sounds good. And so there are a lot of really vulnerable house seats as well. And I know this year, in talking with Karina and talking with the House Caucus, there's more coordination than I have seen in past years, and I love that because we need to really maximize our efforts when it comes to getting, as Jessica was saying, keeping the legislature blue and getting these vulnerable seats elected. Do you have anything in particular or special that you're going to be doing for some of those vulnerable House seats?
I think the biggest thing is allocation of resources, like placing field organizers with that in mind. So when I went through the entire state and basically cut it all up into little pieces, one of the things that I kept in mind is making sure to not put too many of those targeted House races in with one field organizer. Because again, most of the conversations we have, we aren't going to talk about every single person, but I think making sure that we are giving organizers manageable turfs in those areas of importance is really important.
Yeah, and the big thing that we have going for us is that our Democrats have done so many good things. We don't have to just kind of be hesitant when we go to those doors. We have so much to talk about, to say we have good policies in place because we have Democrats in office. And so that makes it so much easier, so much better to be able to do that. Is there any work that's going to be done for the HJR1 for the early childhood education? Will there be any coordinating with that campaign?
I can't remember. We've had a conversation with them. I can't remember what the specifics were. I think that they are running an IE program, but they are also going to be using that democratic data exchange to make sure that they're talking to the right people. But I can't remember the specifics of our conversation.
Okay, yeah, and that's a really important one for those of you who are on the call who are not aware. It's going to be on the ballot, and it has to go before the voters. And this is taking a portion of the interest rate from our land grant permanent fund to use to fund universal early childhood education and also to put toward K through 12 education. And so because it taps into our land grant permanent fund, it requires a constitutional amendment, and therefore it has to go before the voters. It already passed the legislature. It was signed by the governor, but now we, the voters, have to approve it as well. So it's very important that we get our family and friends to vote yes on that amendment, HJR1, and that'll be on the November ballot. So does, Barbara, you have a question there?
Another question, can we get the actual wording of that amendment? Do I have to wait until the league comes out with it? Can I get it before then?
No, it'll be available. There's actually an entire campaign separate from the state party that's working on it. And we'll try to get the website to you, Barbara. We'll get it. Maybe we can run something.
Cool. I'd like to be able to pass on real details to my to people when I canvass. Thank you.
You're welcome. Thank you. Thank you for the question. Does anybody have any questions for Sean or Jessica? We have a lot of leaders in here. Tom, you have a question?
Thanks, Flora. I did put one in the chat. I was looking at Act Blue for a good general committee to donate to for the Democratic House campaign statewide. And I put that question into the chat, something called the New Mexico House Democratic Campaign Committee And I just wanted to I hadn't seen it before. Wanted to verify that that is the valid best one if you want to generically donate to all house campaigns in the state.
I see Jessica giving a thumbs up to that. So that would be the place to go, Jessica, for.
Yeah, and I'd also really encourage you to look at your own local races too and go directly to the candidates and campaigns, because
Yeah.
those of you who have been around for a while know me, and I ran in a really tough house race that was not a priority race because no one thought we'd win it. And Sarah was there from the beginning, Flora was there. I mean, there were lots of you on this call who, Tom, you were there from the beginning.
I was.
We came within 140 votes. But because we were not a priority race for the party or frankly for the House caucus, they were incredibly helpful. I mean, I want to be very clear here that this was an incredible organization that was able to help. But I would also really encourage all of you to do a little bit of Googling, find out who your candidates are in your home turf or in your closer areas, find out where the tough races are, and give them a little love too, because I can tell you personally from experience, that $25 at a critical time does make a huge difference. So you might not be the person, I'm not the person, right? I wish I were. I'm not the person who can throw $5,000 into any kind of race. I just, including my own, I don't have it. I can't throw it into the party. So I give my time and my energy and my resources in that capacity. But do not underestimate a $20 donation here and there. The House Caucus organization is incredible because they do provide all the data costs and everything else, and they do get boots on the ground. But I would also strongly encourage anybody on this call to really look for who your local folks are. And please do not forget about our statewide candidates. One of the challenges that I bump up against, even when we go to national events with the DNC and with the Association of Democratic Chairs, like the committees across the country, everybody thinks New Mexico is so safely blue. And you don't have to worry about the AG's race. You don't have to worry about the auditor's race. You don't have to worry about the treasurer's race. You don't have to worry about your Secretary of State or your land office. They're just going to win, right? My friends, all of those races do need resources too. So if you are able to do relational fundraising, right? If you have a candidate or someone that you know and that you're working on, I mean, guys, I can tell you, I do this all day, every day. Take 10 minutes out of your life and ask your friends and your family to chip in $5 here, $5 there, right? And it's so easy with Act Blue nowadays. You would be so amazed at how much resources that you personally can generate for your county party, for your state party, for your candidates, if you just make that ask. Because if people are not asked, they will not do it, right? So if you have candidates that you care about, if you are in a tough house race, or if you know of tough house races, please make that ask of your networks, right? One person on this call, my friends, if you ask 10 people to donate $50 or to donate $22 a month, by November, that adds up. Do the math real quick in your head, everybody. I guarantee you, everybody on this call has 10 people in their phone contact list that you can ask for $10, right? So I'm throwing that out there to you. I really want to get our state central committee working on that. Our budget and finance committee is working on that. It's not a heavy ask for a lot of folks. And I can tell you these state candidates really need it too. So don't forget about our state level offices, our legislature, you know, of course, the governor, everybody else, a little bit here and there. If we all do just a little bit, it does make a huge difference. And that difference compounds when all of us reach out through our own networks too, even if it's $5.
Yes.
I'm off my soapbox.
Yeah, no, it's a good soapbox to be on, because it, as I think it was you or Sean that said, you know, that is just the way races are won right now. We are not at a place where we can't do it without money. We need resources to make that happen. And with that, I do see Cynthia Borrego, one of our candidates for the House, has her hand up. And so Cynthia, do you have something you'd like to share?
Hey guys, ladies and gentlemen. First of all, I just want to thank Jessica and Flora and everybody for the work that you guys do, especially our ward chairs and our precinct chairs. But one of the questions when you were just talking about that House bill, Flora, is it'd be really nice to know or have a resource of where we can go to look at bills that are really important to Democrats so that we can get a little bit more educated on them. I don't know if you guys can put that out in maybe one of your newsletters. Like, here's some key bills that we're looking at, and here's what they do, and here's who's affected or whatever. I would really personally, not only just for running in my race, I certainly don't pretend to know every bill that's out there. That, I mean, the explanation that you gave for that particular House bill, you know, was enlightening for me. And so I mean, you know, we don't follow this stuff every single day. When you're running, you have to find out the information and you need to know. But just for the average voter, it would be great to have that a little mini resource. So if there's a way to put a compilation or a little summary of what some of these key bills are, I would love to see that. So that's just my 2 cents. And thank you guys for doing this tonight.
Oh, you're welcome. Thank you for being here. And if people, this is Cynthia Borrego is running for House District 68. She is our candidate, our Democrat for that seat. And we're so glad to be able to canvass for her, phone bank for her, and donate to her campaign as Jessica was
17.
Please.
And trust me,
Oh,
my
17,
race
I'm
is,
sorry. It's
my race is definitely going to be one of those that's targeted. So
yeah,
we
it's
were
one of the
only,
vulnerable ones. Yeah.
if you look at his numbers, my opponent and Ellis McMath, who's Dan Lewis's former treasurer, by the way, and his next door neighbor. If you look at the difference between how many Democrats and how many Republicans, I got about 100 more than he did. So I know that my race is going to be one of those key races that's going to be targeted.
Yes, it is. And it's important to get out more. Well, thank you, Cynthia. Cheryl, if you could take 1 minute, we are at 7:29. So 30 seconds, even if you could do that so we can wrap up here.
Okay, I just wanted to congratulate Cynthia, first of all, for winning in District 17. I was getting ready to call her and invite her to lunch so that we could talk about legislation. And Cynthia, I'd be more than happy to go over legislation with you and the legislative website and lots of resources for you.
Thank you, Cheryl. Appreciate that. It's always wonderful whenever you have a personal conversation with that. Well, with that, I would like to see if Jessica and Sean have any closing remarks in 10 seconds or less.
Keep it 10 seconds or less, my friends. There are many, many ways to get involved. Reach out to your county party first because they know better. And this is true across the state. The state party is not that big, right? We don't have that many staff. We absolutely need boots on the ground in every single county. Please donate money. If you can't donate money, volunteer your time. You can also organize a party, right? I want to put a plug out there for house parties. Maybe you can't give $5,000, but you can raise $5,000 through your networks. Consider that. This is the season for that work. So my friends, thank you so much. I am so thrilled and honored to be a Democrat tonight. I am proud to be your chair, Jessica Velasquez of the Democratic Party of New Mexico. Boy, my heart is with us. Let's go team, go and get it done in November.
Yes, thank you so much, Jessica. Sean, do you have any closing words you'd like to share?
Nope, just very thankful for all that you do and the hard work that everyone's doing. This is the season, so thank you all.
Thank you very much. Appreciate you both being here. Thank you, everybody who is on this call. True progress, real promise. That's what we have. That's the campaign Democratic Party of Bernalillo County is running. And we look forward to working with each and every one of you to get Democrats elected up and down this November's ballot. Thank you so much. Have a wonderful night, everybody. Good night.